Okay, you're live.
Hey guys, it's Dr. Emer. It's been a long day if you've been following us on social media, but this is the best end of the day that any doctor could have. One of my good friends here getting a little tune-up, nothing big, she's very beautiful, but all we're gonna do is just soften the folds around her mouth and do a little lift to the mid-face. The one thing I wanna show you, come in real quick, is a lot of women, as they age, they start to get a little bit of sagging right here. One of the things you can do is just lift this up slightly and it helps the folds. And that's an easy thing to give somebody a nice improvement, makes them look a little bit more rested, and we go from there. That's perfect. And we're gonna use Juvederm and just give a little softening to her face. It's not gonna be anything aggressive. I'll be really gentle, and we're just gonna soften. Now, normally we're not just line filling, you guys, you know that. We're kind of lifting and contouring. But one of the things that really bothers her is the fact that she has a little bit of these lines. So we're just gonna soften it slightly. Nothing crazy. We're going back to the basics. This is basic learning on how to improve a fold. We're doing about half a syringe there. And then I'm gonna have her smile, relax. And we're not gonna go laterally here. We're just gonna go right slowly down to the mid-face, and this actually will help the under eye a little bit. Our long-term plan for her would be to do some skin tightening procedures and some things to actually remove the eye bags themselves. But this will soften and give her a nice elevation in the fold, and she'll look great. We're not doing much, very little. We're not going too lateral at all. Great, and you can see right there, just a little lifting and a little softening. Look at the one side versus the other. It looks really, really natural, and it's gonna be perfect. Now I'm gonna have you hold there. We're gonna go to the other side. Is anyone saying anything?
Not yet.
No?
Not yet.
Was it terrible or was it okay?
It was fine.
Okay, good.
It was great. Yeah.
She's so cute.
Yeah.
Okay, relax again, smile again. So again, the biggest thing with her, we're not gonna go too laterally, just wanna give a little lift, relax. And I wanna follow her natural smile, just a little softening. And what's nice about Juvederm products in general is they're very soft. And depending on which one you use, you can get a little bit of hydration to the area, which will give a natural volumization there without looking overdone. Like, look at that. Just that little bit, it's already improved. We're just gonna do a little bit more towards the upper part of the fold. That's perfect, smile now. Great, and again, all I wanna do is give her a little bit of lift to her mid-face. So some people call this the deep medial fat pad. Some people call this the inferior ocular fat pads, but we're focusing on lifting this area of the mid-face to help her folds and her under eye, but not going too much to the lateral cheek, because that's not what she needs. And then that's it. And that's softening. We didn't do the under eye or cheeks, we just did lifting and balancing for the fold. So take a look up close at the final result. I think that's a really nice improvement, a really subtle improvement, and then long term, now our folds are improved. We'll work on doing other things for under eyes and cheeks, etc. in the future. Thanks, guys.